Hi, my name is Kaylee,
My name's Lauren,
and today we'll be demonstrating two vital signs, the pulse or heart rate,
and the respiratory rate. What may impact someone's vitals, you may ask? Well, how in shape they are, how active they have been, environmental temperature, age or sex, emotional status, or physiological status.
When should we check these vital signs? Well, if a patient is confused, excessive fatigue, diaphoresis or excessive sweating, decreased command follow, decreased response, or syncope, also known as fainting.
Now on to pulse.
Pulse is an indirect measure of the left ventricular contraction. It indicates the rate at which the heart is beating and can be palpated at various sites of the body or measured through oscillation over the apex of the heart with a stethoscope. Today we'll be taking radial pulse. Radial pulse is measured at the radial artery in the wrist by the thumb. You will place palm of hand down with arm on flat surface. You will then locate pulse on thumb side of wrist using your first 3 fingers. Make sure you do not use the thumb because it has a pulse. Exert slight pressure and count for 1 minute or 30 seconds and times that number by 2. A normal pulse for an adult is 60 beats to 100 beats per minute. For infants, 100 to 130 beats per minute. And children, 80 to 120 beats per minute. If the pulse is over 100 beats per minute, that would be considered tachycardia. If the pulse is under 60 beats per minute, that would be considered bradycardia. Why might you pick a particular place to take a pulse? Another site is not accessible. There was trauma to a site. You had surgery to a site, which sometimes the radial artery is harvested, or you're checking for blood flow in a particular place. It's important to know many locations for pulse, so you can be aware of these things. Temporal, carotid, brachial, and femoral are a few others.
Now we're going to go over respiratory rate. So how you take a respiratory rate is first you always wash your hands. You simulate taking the radial pulse. You count either the patient's inspirations or expirations for about 1 minute to 30 seconds if you're taking this also with the radial pulse. The patient may need to be adjusted if linens or shirt is blocking your view. In and out is 1 breath. Adults typically perform 12 to 18 respirations per minute. With anything less than 10 and greater than 20 respirations per minute is abnormal. Infants typically perform 30 to 50 respirations per minute. While taking a patient's respiratory rate, you should notice rate, rhythm, depth, character, amount of work it takes for the patient to complete 1 breath, and the sound. Normal breathing does not have sound. You may need to use a stethoscope if the patient is really ill. Normal respirations should require minimal effort for the inspiration or the inhale, and almost no effort for expiration or the exhale. Your patient may be a thoracic breather or chest breather, or they may be an abdominal breather or the stomach. Note that when you're taking the respiratory rate, do not let your patient know what you're doing. Respiratory rate tends to change when someone knows someone's watching it.